Good afternoon. This is Dr. Anuj Bhargava from Iowa Diabetes. Thank you so much for joining us today. These are tough times, definitely tough times for all of us as a society, as a nation. There's so much going on. Every single day brings more things. So I'm glad we have the opportunity to have a conversation today about diabetes and COVID and what we could do during this time. Let's begin with some intros. So I'm Anuj Bhargava. I'm an endocrinologist or a diabetes doctor. Since 1994, I've been very interested in figuring it out how we can change diabetes, how can we do better. That was in India in 94 and came here, did my residency and fellowship, and then moved to Iowa about 17 years ago. And it has been one amazing journey. I was part of a clinic for 17 years. I started clinical research. I've done about 100 diabetes trials in the last 15 years. We started a platform for patients with diabetes called Iowa Diabetes Portal. Our team is just very interested in anything and everything we can do to change diabetes. And with that intent, we are here today as well with questions that you have during this time. So that's my intro. Dr. Jamie Petlik is with us as well. She is going to be in the chat. So that's kind of a brief that I wanted to begin with. Our team put together some questions that you may find helpful and useful during this time. And we'll go over those as well. All right. So diabetes is a 24/7 disease, right? The challenge of this is all is how do I make decisions on a daily basis, and how do those decisions change during these tough times? So I'm just going to walk through a complete diabetes management plan and say these are the different components, and this is how it might be different right now. Let me just first take a question. The question from Maria is, why is coronavirus more dangerous for patients with diabetes? In the news, we hear all the time about patients with diabetes, be even more careful. It can be worse in you than others. And in general, what we have learned is patients with diabetes, and I'm talking about the ones who may not have as good a control. Um, the well-controlled diabetic probably does not have a change in their immune function enough to make the immune system weaker in their defense against coronavirus. So if you have well-controlled diabetes, you're probably okay and your risk is similar to other people. But in general, diabetes comes with times of uh, lack of control and also other medical conditions. So when you have two or three medical conditions, your risk goes higher. In what way? Well, first of all, you have higher chances of getting an infection, and that's true for flu, that's true for coronavirus. Second, when you get the infection, and if you don't have as good a control, your sugars may go higher. And what that means is that now your immune system will get compromised. It will not fight as well. And so your complications from coronavirus will be higher as well. So that's in a general why it's more dangerous, more likely to get it, and more likely to have complications. The second part of the question was how can we make things better? So that's where I think I want to talk about what things. And again, you guys live with diabetes, so you truly understand what the challenges are. And I'm going to break it up into lifestyle, the nutrition and activity, then blood sugar checking, so the monitoring, doctor visits, and also sick day guidelines. Um, so those are the things I'd like to talk about. So first of all, beginning with nutrition, one of the common things that my patients have asked is, these days I'm eating differently. I'm at home more, so there's more food available. I'm more bored, so I'm watching more TV. So I'm just there and eating. And what can I do about that? So the I think for a patient with diabetes, nutrition is such a big deal, such an important part of their diabetes management that we need to figure out how to get a great handle on this. And from my standpoint, I think it begins with mindfulness, mindful eating. That when you are eating, make sure you enjoy the food. Make sure you don't go hungry for a long time, and then you are so hungry that you start eating rapidly high calorie food and consume a lot of calories. So have a schedule of your day. So many of you may not be working today, these days, and if you're at home, then the lack of a schedule is another problem. So maintain your schedule. So if your breakfast is 7 when you leave for work, then go ahead, have it at 7, and then noon and 6. Maintain that schedule. Don't have these long periods without eating. Secondly, think about the kind of foods you're bringing home. Um, in my mind, the weakest link in the chain of consuming a bad food or not so good food is when you buy it at the grocery store. If you buy smart and got the right things home and you didn't even have those other things, you're not going to run to the store to get the bag of chips or the cookies. You're going to eat what you have at home. So, one of the things I tell my patients is always, always buy smart. Buy smart. So, when you are ordering online from your Walmarts and Instacart or whatever, just think about that. Buy on a full stomach. If you're going to go to the online, because my wife is ordering online these days, right? The idea is to go on a full stomach, and then you will probably make better decisions about what kind of foods. So break the chain at the grocery store, is what I say. Then once your food is at home, again, make it out of sight, right? If you will see it in front of you, you'll just eat it. So make it out of sight, and that will help as well. And then the general rules you guys have already been following around portion control and distributing your carbs still hold true. So that's, I would say, for nutrition. There are a few comments here. Hold on. Um, so Michaela Harrison is asking, what is the best way to boost your immune system? In the context of a patient with diabetes, there are a few things that you can do. The first one is to keep your blood sugars in the right place. So, if your blood sugars are well controlled, when I say that, I'm saying A1C that is determined by your doctor. And by the way, one disclaimer, I'm a physician, I'm very passionate about diabetes, but I'm not offering any medical advice in any of these. Anytime after this conversation, you have treatment decisions to make, talk to your doctor. With that said, the first thing a patient with diabetes can do to build their immune system is get good blood sugar control. They have done many kinds of research where they have shown when people have high blood sugar, they're more prone to infection. They have done research where they have looked at the white blood cells and exposed them to higher sugars, and then they realize that for several days your immune system is down. So the number one thing, Michaela, is to keep your sugars down in good control. What is good control, as discussed by with your doctor? An A1C typically of 6.5 or 7, and blood sugars about 80 to 130 fasting, and in my mind, below 160 for rest of the day. Because once you start going above 180 and 200, then you're affecting your white blood cells. Second way to boost the immune system is to exercise. It's pretty amazing. Exercise, I'm a huge fan of, and it definitely also boosts your immune system. Now, how do we do that in this environment? Of course, we cannot go to a gym. So hopefully you have some exercise equipment at home. If you don't, walking outside is fantastic. Um, that is one thing you could do. Of course, social distancing on all of those things you want to definitely take care of. If you have no exercise equipment, no nothing lost. Stairs, going up and down the stairs at your home, another great exercise. And the last thing I will tell you for exercise is that so I traveled a lot before Corona, right? So I didn't have the time to go down to the gym, be in the right attire and the shoes and all that. So I went online. I found a whole bunch of videos, and I found one which is a low impact, like you could do in a hotel room, and the downstairs guy is not going to call the front desk. A 16-minute video. I will send it out to you guys after this, the one I use when I travel. And that is basically using your body weight and stretching. This guy does a pretty marvelous job. I'm a big fan, great energy. And there's a whole bunch of videos out there online that you could use. So, Michaela, this the second thing is exercise. Lastly, in general, I am a big fan of believing that food has impact on just about everything, including our immune system. In general, a plant-based diet, non-processed diet typically will help. So those are some of the things I would say for how to boost your immune system. Um, Kendall has a question about being a nurse and having type 1 diabetes. First of all, thank you, Kendall, for serving and doing what's needed for our patients. Thank you very much. The safety, I think, first is follow whatever else is being asked at work, right? That's absolutely the most important thing. Second thing, I think the boosting immune system that I talked about right now. The third thing I would say, which is what my wife asked me to do, and when she said it, I said, "Hey, that just sounds a little too much." But then I read it in a handout and stuff like that too. When you reach back home, this is important. How do you then go in the home? I would recommend having cut a disinfection area, which is where you could have your groceries as well. And this was nice tips that came to me from, I think, CNN. There's a amazing handout, which also I'll share with you guys after the end of this conversation. They have a disinfection area where your grocery bags and your mail and all that stuff goes. Leave it there for 2, 3 days. That's the time coronavirus, for example, takes to go away from some of these things. And for yourself, just wash your hands before entering the house or right after in that area. Change your clothes right there. Get rid of those ones, don new ones. You want to take a shower because you want to break the chain. When you're coming back home to your loved ones, you want to break that chain. So this is where you want to um, follow these precautions when you're coming back in. At work, if there is a way to be in a location where you are less exposed, that would be helpful too. One of our team members has type 1, and so that is our concern too, is, hey, what do we do with that? Okay. Jamie Pidlick, our pharmacist, mentioned, you know, um, I'm just going to read that comment. Give me a second. Yeah, the uncontrolled blood sugars, just emphasizing the point that a controlled, like Bill Polonsky, one of the best behavioral scientists in diabetes on the globe, he says controlled diabetes is a cause of nothing, as opposed to high blood sugars, and that can lead to chronic complications and acute complications. Another question comes up is my mom is worried about recession, right? Things are going to change. Our The money we had is going to shrink. So how do we save money on diabetes meds or supplies? Here's the thing. Diabetes is expensive, absolutely one of the most expensive diseases. So we totally understand the amount of things happening around insulin prices. Several fold increase over the last 15 years. It's crazy. Doesn't make any sense. Now, good news is on the way in many different ways. But I think the first thing is, how do you save money on insulin? Many pharma companies started programs for reducing costs. Lilly and Sanofi for sure have. Um, Also, if your current insulin is too expensive, talk to your doctor about other insulins. For example, and I'm not a fan of NPH insulin in type 1, but in type 2, they could switch from a long-acting insulin like Lantus or Levemir or Tresiba or Toujeo to NPH. It may be twice a day. It may be not as good or stable of a control, but the cost difference is substantial, just substantial. So think about that. Um, are you checking the right amount of time? Sometimes we get in habit and are checking too often. Most of the time, not. Most of the time, people are checking less than they should. Look at that. Our Iowa Diabetes portal has a ton of options for saving money on medications. So you can go there, and once you add medications to your list, you'll be able to see prescription assistance programs, coupons for every medication under the sun. And you can see our own drug discount coupon. And then you also have 5 tips from us on most of the relevant medications for you. So those are some things about cost. It's just insane. Means things, I used to think things could get any worse before Corona, and I realized they could get worse. And right now we are in that situation. Okay. All right. Kathy has a question. I'm a healthy type 1, 65-year-old. What happens if I contract corona virus? Why is it more dangerous for me, or is it not as bad since I consider myself healthy? Yeah, I think you've answered your question. First of all, if you're a well-controlled patient with diabetes, you will probably do as well or as worse as I might do in that situation. So I think in that sense, you're okay. In general, there's still a concern later on. Let's say you got it, and then in my case, my sugars may not go up. In your case, sugars may go up. So this is where the sick day management comes in, and I'll use this as my pointer for sick day management. In that scenario, your sugars may go higher. So follow your sick day guidelines. If you don't have them, I think we did a blog on them. We'll send that as well, and we'll send some more information on sick day guidelines. But maintaining your monitoring, check your sugar, CGM, or your monitor. Make sure you're checking enough. Here's one other thing I'm reminded. I think you guys need to plan for not being able to get your med or strips for a few weeks, let's say, or a month or two. Make sure you have enough supplies of your insulin and your essential meds. That's absolutely critical. Please do me a favor this afternoon or right after this conversation, go back, look at much insulin do you have, how many meds do you have, and if you don't have more than 30 days, act now. Ask, ask for help. So going back to Kathy's question, sick day guidelines, right? So check more often. Maintain still some nutrition and hydration for sure. If you are on insulin and type 1 ketones, check your ketones. If you have ketones, you may need more monitoring and more insulin than usual. So these are some of the things you would want to do if you got in that situation. Amber has a question about I was in DK when I first went in with symptoms. I was seen again a week later and they refused to test for DK even though I told them my blood sugar had been super high. Um, I cannot get my doctors to help me. I'm in quarantine. So I think that may be a challenge for many of you. And again, I think there's something that might be helpful to you. Uh, for telemedicine, ask your doctor if they can do telemedicine for you. That's Diabetes is a perfect disease for telemedicine. Look at it. Means what the kind of things we do are not like we're not injecting something, we're giving advice to you. The kind of information that we need is something we can easily get from you. Sugars through the Dexcom portal or the Medtronic portal and so forth. We can get all of those. If you are just using a sugar meter, Iowa Diabetes portal, you can log your sugars there. Or you can connect your meter. So we can get your sugars as well. So at Iowa Diabetes, we just started telemedicine, very, very recent. And so if people want to know more about it and apply, they can go to iowadiabetes.com and click on virtual visits, and they'll be able to apply from there. So if you need help, we are happy to do virtual visits for you as well. So that's an option available. Unfortunately, we work directly with patients. We do not work with insurance, so there's a charge for that. $150 for a new patient, 95 for a return. We try to keep our costs absolutely as low as possible. Jamie has sent us some links, so that's great. Thank you, Jamie, about Lilly, Novo, and Sanofi. These are the three big manufacturers, and now you have information on that. So that is fantastic. Thank you so much, Jamie. Jill, type 1 on pump hair. Should I be working? I work on a maternity center at Des Moines Hospital. Um, Great question. This brings up the dilemma I have myself. Should I be more at the forefront? Now, I'm a diabetes specialist, so my way of giving back is to start doing these telemedicine visits, and we do cash or free. I should say we are also doing free because we know people are struggling with costs. So we are also doing free based on income criteria. If you are, um, and Jamie will tell us what the criteria is in a minute, then we can also see you free. So the question about should I be working, that's a hard one. I don't know the answer myself either. Should I be going more forefront? When I see people being called out of retirement in UK and New York City, and this flight going with healthcare workers to New York City to man this hospital, which is built in a stadium with 1,000 beds. So I'm still trying to find the answers for myself, but my intent was to start sharing the value I can. 25 years I've been doing this. I wanted to share what I can. This is why I'm here. Back to your question, Jill. The answer is I don't know. Means from a health perspective, make your concern aware to your supervisor for sure. Ask them if there's a lower risk situation where you could work. The other thing I would say is the Families First Act just came up with the ability for people who have health concerns or who have been advised by their healthcare professional to stay home because of a certain medical condition or so forth. They can apply and get PTO, get um, I think it's up to 12 weeks of PTO from their employer. The employer pays the PTO, but the government pays the employer. And this might be true for small businesses only. And Des Moines Hospital with Maternity Center is not a small business. So just look at what options you may have. Okay. All right, so going back, we have about 7 minutes remaining. Thank you for all the questions. This is why I'm here. I'm not here to just give my opinion on how patients with diabetes should do things. It's more about answering your questions. So I kind of begin with this idea that what all should we do? Like, how do we get better, right? We talked about nutrition. We talked about activity, hugely important means this is the time when we are socially isolated. And mankind has a need for social interaction absolutely everywhere. So if you feel down, exercise has a pretty remarkable influence on mood. Really, really good. So I would say exercise is a huge part of your health right now. Third thing is monitoring. So how often should I be checking? As advised by your doctor, but if your sugars start going higher, follow the sick day guidelines that they might have given you. Make sure you have everything for monitoring for at least 30 days, if not 3 months. Your monitoring supplies, your insulin, ketone strips, anything that you need, please, please, please. And that I'm asking you, there's only one ask today I have is after this call is done, go to your medicine cabinet. There should be no excuse to do anything else. Go to your medicine cabinet and just find out, do you have everything that you need? That's my main ask from you today. Um, the next thing I want to talk about is then monitoring. We talked about how do you get an A1C today? Your doctor is not seeing you. So A1C now is available on Amazon. It's not as accurate as the one done in your doctor's office, but it can give you some idea. Iowa Diabetes Portal has a very cool tool where if you have entered enough blood sugars, it will show you estimated A1C, and we use that a lot as well. If from a standpoint of seeing your doctor, many doctors are doing telemedicine. Do it. There's no harm. You got to do it. It's your known doctor you've seen for years. They most likely are doing telemedicine. So go ahead and do telemedicine. Absolutely. Diabetes is perfect for telemedicine. So make sure you are seeing your providers. And as I said, you can see us at iowadiabetes.com. We are more into specialized diabetes care where you need substantial help with insulin and so forth. So just make sure to see your doctor. Next question, do you recommend a person who has type 2 uncontrolled diabetes stay home? I think if somebody has uncontrolled diabetes, the first thing, try to get in control. It's just the right thing, absolutely. So that's the first thing. But yes, you've tried hard and it's not happening. Yes, you definitely are one who could be considered immune compromised and at higher risk than someone else. So please isolate yourself, quarantine yourself, and so forth. By the way, while you're going to your medicine cabinet, also that syringe from 2005 or that pill from 2009, go ahead and throw that too. This is a good time to clean things up too, right? Here's another thing, spiritual part, right? How do I stay then sane in these insane times? So solitude is amazing, right? Loneliness versus solitude, two different things. If you have solitude, use it. As I was listening to a guy from China who just came out of quarantine 70 days later and had not seen any of his friends, he said, I was able to know myself better. That's one thing he did. And then he said, I watched a bunch of YouTube videos on the things that I needed to learn. So give yourself a goal of acquiring a new skill during this time or achieving something. Or let's say, I'm not going to gain any more weight during coronavirus, or I'm going to lose 5 pounds. Give yourself a goal that will help tremendously. And then meditate, amazing. Music has an amazing influence on ourselves, so do that. TV, of course, you could watch, but sometimes you can watch too much TV. I'm not a huge fan of TV. How to exercise and diet during crisis? Any tips or tricks? I think do what you can. That's the main thing. We talked about it earlier. Do what you can under the circumstances. You do not need even one single piece of exercise machine to exercise. Kathy has a great point. She was usually doing 30-day supply, and then at my past clinic, she was able to get 90 days worth of supply. That's a great thing. And then I know mail order could have some concerns, but these guys who are doing a fantastic job are mail delivery and supply delivery people, and just follow the instruction. And we'll send you that tip, right? So you could use gloves. You could then take it out, wash your hands, clean everything you get with disinfectant wipes and stuff. So there are things you can do. If I were you, I would not be afraid of getting a 90-day supply. I would just do it. But once it comes, I'll have my disinfectant or quarantine area at my house. I'll open it there and bring it to where it belongs. All right, getting much closer to the end. Again, amazing, great questions. I love it. When will we be back again? When you need us. We can do it sooner than next Wednesday, but we initially said we'll start with once a week, so we'll join again at 1 p.m. Next week. Me or Jamie or both. We'll see how circumstances permit. So, Jamie also says that the 90-day supplies are in cool packs and have temperature controlled packaging. So that's something to keep in mind. You'll be okay. My wife gets all her meds, many of her important meds through the mail order, and that's just fine. It's a great idea. All right, it's coming to an end. So what are some key points? You guys can, I ask in all my lectures, I say, what was the key thing you remember from today? What's that one thing you will take back home? So please type that into your chat box at the last thing. While you do that, I'll emphasize the number one thing. Go back after this. Don't do anything else. Go to your medicine cabinet, your medicine supplies. Make sure you have 90 days or more. That's the first thing I want to say. Second, get your diabetes in control. Your risk will be much lesser if you could get diabetes in control. That's absolutely important. And then, diabetes is a lifelong disease, 24/7. We got to do everything we were doing and more in this time, and we can. We have the time. Sometimes our reason for not being able to do the right thing was time. Today we have time. Let's use this time well to improve our health. With that, thank you very much, everyone, for joining. Have a great, fantastic day. As I say, stay home, stay healthy, stay safe. Thank you.